Welcome. I'd like to introduce you to the Anthony Jordan Health Center. We were founded in 1968 on a mission to provide high-quality health care regardless of ability to pay. Now, 40 years later, we've grown into a comprehensive primary care clinic that focuses on the whole patient. As such, we've been recognized by the National Committee for Quality Assurance as a patient-centered medical home at a level 3. You may not know what that means, but by the end of our discussion today, you'll understand how important it is for our community and the services Jordan provides. Welcome to our home.
Well, I think the medical home designation and the Joint Commission accreditation are two quality indicators. And I think we need to help educate our communities along those lines so that they know when they're coming into Anthony Jordan that we have met these high quality standards and that it's these standards that focus on their health outcomes to make them all healthier individuals, that's what it's really about. In the long run, it's about having everyone take more ownership for their own well-being and health.
So Jordan is a leader by stepping out and accomplishing this designation so early in the effort. It means not just that, and it is important to get a financial enhancement associated with the high cost of providing this very rich model of care. But what that's really about is that you're producing healthier outcomes. That you're tracking your diabetic patients, you're tracking your asthma patients, you're making sure that people's health outcomes improve. You're actually providing very high quality health care. It's so important to recognize that the model of care that we see in this health center at this moment is setting the standard much higher. The bar is much higher here than it is for private practices around this community who serve middle class, well-insured patients. So we're all lucky if we can come to a health center like Jordan, and Jordan now has a responsibility to provide leadership for the rest of the community.
One thing that we all agree on is that the Anthony Jordan Health Center patients deserve the highest quality care. And the challenge is delivering it in a community setting with limited resources. But we have a very robust EMR, which helps us to organize the information so that we have the right information for every visit, that we're able to track the information that we get from outside providers, that we're able to communicate through this tool to ensure that patient care is continuous and not interrupted and broken looking for pieces of paper, and that our patients get the very highest quality of care.
In one way, there's a lot of patient improvement just in terms of the way you work with a physician and ease of working with the healthcare system. The other piece that is, I think, yet more important is that having that clinical information available for the physician when you show up in an office, lets them diagnose a lot quicker. I mean, they have all that background information. A lot of times they don't have to redo the tests. And some of these tests, like radiology exams and things like that, are not something that you really want to engage in frequently. So if they've already got the test performed somewhere else, they can look at those results and they can start diagnosing you right then. So there's an efficiency in terms of the way you work with, or an ease of interaction with providers, but there's also quality improvement because physicians can actually provide you better treatment with better information.
Two problems that I've seen resolved since the EMR has been implemented at Jordan has been, I think, a more efficient workflow where you are cutting down the time of searching for charts, and that's very, very important because it provides us with more time for patient care. And then communication is the other thing that definitely has improved. Communication with providers in the past, which is very important for us in clinical pharmacy.
Lean Six Sigma is just a methodology. It's just a way of improving processes, eliminating the waste in a system that none of us would like to see there, which makes our jobs easier, makes us more productive and able to do what we're here for, to practice better medicine.
We have used Lean Six Sigma processes to coordinate all of the information in our electronic medical record, in our communications to our customers, in our scheduling and communications to our employees and their supervisors, to really keep the process moving as smoothly as possible with little or no business delay in terms of our employees having access to our customer accounts and no disruption in their service.
So we've done some early work, and we're just looking at the results of this to see, can we use our records management people more effectively, so that when the doctor needs electronic medical records information about referrals and so forth, it's there waiting for them in the electronic system, and they don't have to hunt for it.
We were able to more clearly define what everyone's role in the process was, from the medical assistant to the nurse to the physician. Everyone involved in the process had a much clearer idea of what exactly to do and how to go about it and how to really help our patients. From the moment that they walked into the door to the moment where they were leaving, exactly everybody had their own idea of how exactly to go about giving them the best possible outcome in terms of their health care.
By connecting people to insurance, primary care doctors, by providing transportation, translation services to ensure that our healthcare needs are met. And basically, Jordan has been a tremendous asset to us. Because there are times when we, are faced with emergencies, and someone needs to be seen immediately. And to prevent the emergency room visits, we called Jordan, and they are able to accommodate us.
It's playing a vital role in our network of services, because one of the things that happens is that when people don't have access to primary care, oftentimes what they resort to is going to the most expensive type of care, the emergency room, at the time that whatever condition they have has reached the worst stage. So by having a center that can, through its electronic record system that they have now, be providing more coordinated case management and disease management services, it really helps the community be much more healthy.
Being able to come into a facility like Jordan and not have to be concerned about being treated less than because you don't have health insurance, or you don't have money, or you don't have this, or you don't have that. All you have to have is a need, and it'll be fulfilled. And you can trust that, and you can trust that the care that you will get is on a par with that you'd get were you completely insured and employed and all of the things that people like to respect, that you get those things at Jordan. And I really think that we've lost a lot of the humanity that we need to have for each other, which is why I say that I think that Jordan is really living out the vision and legacy that Dr. Jordan had in mind, because that humanity is really a part of it. And when we start losing the importance of the human effort, there's an awful lot of things that fall by the wayside that really shouldn't. And I don't experience that at Jordan, and that's a good feeling.
We could set Jordan in any of the suburban communities, in any one of them around Monroe County, and they would provide the same sort of care to those residents that they are providing for Jordan. And I'm sure that Jordan will continue that philosophy.
I think the one word that describes Jordan is passionate.
Mission-driven.
Community.
Quality.
Efficiency.
Dedication.
Commitment.
Lifeline for the community.
As you learned today, the Anthony Jordan Health Center is more than just a doctor's office. We were born out of a movement that said we are all equal, and as such, we have a right to high-quality health care. We now stand poised 40 years later as a leader in a movement that takes us back to our roots, access for all. We will accomplish this through cutting-edge technology, efficient processes, and a commitment to patients first. Thank you.
When the night has come and the land is dark and the moon is the only light we'll see, no, I won't be afraid. Oh, I won't be afraid, just as long as you stand